Hi, I'm Dr. Marc Taub. I am an associate professor at Southern College of Optometry and chief of the Vision Therapy and Rehabilitation program at the college. I have been there for 7.5 years and been teaching for 10 years. Our service is combined of three different services, three different areas. We see patients with low vision, keeping the vision therapy, the rehabilitation spectrum. We see patients with learning-related vision problems, normal kids. And we also, probably our biggest area of growth is our traumatic brain injury service. So we see a wide variety of patients from very young, from age 2 with maybe esotropia, to older patients with low vision needs, as well as those who have suffered a traumatic brain injury of all different ages. Several of our doctors are on staff at rehabilitation facilities, and we work with the occupational therapists and the rehab facility and doctors there to be part of that spectrum of care. So the article that I wrote today that you're reading is all about vision therapy. I am actually a vision therapy graduate. I did vision therapy when I was a kid with Dr. Elliot Forrest as well as Dr. Joel Wallstreicher. I was kind of that typical kid, had trouble paying attention in school, and was kind of starting to become a behavior problem, really because I was getting headaches and I didn't really want to read. So luckily, my parents had the foresight and had a wonderful doctor who made the recommendation to get me to Dr. Forrest and Dr. Wallstreicher, and I enjoy what I do. I give back to those doctors who helped me by helping other kids, and perhaps maybe one day a child will become a vision therapy optometrist because of what I did for them. So today's the topic is kind of my top 10 vision therapy pieces of equipment. Each one, of course, can be used for many different purposes. Such as the Wolf wands, probably the first one on the list. The Wolf wands are wonderful in that you can use them for hand-eye coordination. You can use them very closely, very close to the eyes, to get the patient to realize where their eyes are in space. They're very wonderful. Of course, everybody's favorite Brock string, understanding of physiological diplopia, as well as understanding where their eyes are pointing. The vectorgrams. Vectorgrams are probably something that everybody remembers from school. Everybody remembers the Coit vectorgram and the clown, that evil little clown. But then we've got some newer ones, the vortex, which is wonderful. Use the understanding of silo and soli, and where their eyes are pointed in space. A little bit more gross motor, we have the balance board. The balance board is wonderful in that you're bringing in the entire vestibular system and understanding where your body is in space. Of course, everybody loves lenses and prisms. Vision therapy program could not be successful without the proper use of lenses and prisms. And I'm not talking, plus 10, those, but even small amounts of plus and minus, kind of the bouncing back and forth, but even the clearing of small amounts of plus and minus are very useful. Of course, everybody, all of the kids love the use of the iPad and the computer programs. And luckily, in the last 10 to 15 years, these have come a long way. Programs like Vision Builder from the Optometric Extension Program Foundation, as well as the HTS programs from Holmes Therapy Systems, Mr. Rod Bortel, have come a long way. And we could even do therapy from afar. And the results get transmitted to a database with the HTS programs, and you can log in. I've had patients doing therapy from as far as Turkey, so was kind of a neat process. And of course, you've got the big ticket item. You've got the Salmon Vision integrator, which is a 52-inch touchscreen that kids absolutely love to play with, and it's great. You can change the target speed, you can change the target size, just absolutely wonderful. Just keep in mind that you don't have to have all of these items, but these are the ones that I've come to love and to use quite often. And the type of items don't necessarily talk about the type of vision therapy you do. It's most important you be comfortable with what you do, and take a look at these items. And of course, if you have any questions, you please feel free to email me. My email address is mtaub@sco Thank you very much, and I hope you enjoyed the article.